Hello, Lake Providence Church family. This is Dr. Linda Plummer Ward here with an update on the COVID-19 pandemic. As you know, we began phase 2 of the mayor's reopening plan on May 25th. All of the businesses that reopened had certain restrictions that included the number of employees at one time, hand washing, temperature checking, masks worn by employees, and sometimes by clients, cleaning and disinfecting the facility, and social distancing. So be aware that those things should be done. Phase 3 was delayed because Nashville's case numbers began to rise. We expect an additional increase in numbers in the next week or so as a result of the recent protests for racial injustice. All those involved in the march are asked to be tested after a few days. The numbers are important because they help to predict and ensure that there are an adequate number of beds, healthcare workers, and equipment for those who require hospitalization. This week, the governor added the following updates about 3 days ago. Nursing homes and rehabilitation facilities will reopen on Monday with special restrictions for visitation. So if you have a loved one that you plan to visit, you might want to call ahead and see what restrictions you need to comply with for that facility. The government will assist employers with pop-up testing stations. And the third update he gave was that there would be increased testing in minority communities. As we reopen, we should continue to practice habits to reduce risk of infection and use good judgment to stay safe and healthy until we have a vaccine. Vaccines are made of substances that come from the virus. Scientists alter these substances to prevent them from making us sick. When we take the vaccine, our bodies recognize it as a foreign substance and forms protective proteins that are called antibodies to attack that substance. Later, if and when we get an infection from the actual virus, the antibodies that we formed to that substance recognize it and attack the virus. This is a simplified way of how our bodies become immune using a vaccine. There are about 100 studies going on right now in different stages to discover a vaccine for the novel coronavirus. Some are already doing studies on human volunteers. It is expected that we may have a vaccine ready for production by the end of this year or early next year. We're able to speed up this process this time, not just because of the White House, but because we've studied the coronaviruses before. We had 2002 and 2012 infections caused by coronavirus, so we're a little familiar with it. Secondly, we now have the technology to use the genetic makeup of the virus, so we can use its DNA or its RNA in the vaccine. Healthcare workers and high-risk patients will likely be the first ones to receive the vaccine. And even if the vaccine is taken, the body will need a few weeks to form the antibodies to make it immune to the virus. I can imagine that this is frustrating and sometimes confusing for you, as it is for us in the medical field. Our knowledge of this virus and treatment processes change all the time. Fortunately, you and I know who has the final say. So we put our trust in Him who is our keeper, and we continue to make good choices to keep ourselves and our families safe. Make it a point to pray for and check on the vulnerable ones among us. Let's continue the habits of covering our cough, staying home when sick, washing our hands for 20 seconds, wearing our mask, and practicing social distancing. Remember, wearing a mask protects others. So let's continue to show love to each other by wearing our mask. See, when I put this on, It hides my smile, but it shows my agape love for you. Be safe, be healthy, and stay prayed up. Thank you for listening. Have a blessed day.